Hello and welcome, everyone. Thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic. It's nice to have everyone here today. The Zoom chat is open, so feel free to introduce yourself and then the name of your organization. During the panel discussion, we will turn off the chat. We will turn it off so it's not distracting for the presenters, but then we'll turn it back on at the end. Just want to remind folks to please be kind to each other. We want to keep everything nonpartisan. And please also, if you'll respect the venue and not sell anything on the side. At any time during the webinar, you can submit questions for the panel using the question and answer feature. So we are going to start with our usual poll to find out what type of organizations are represented today. Lexi, can you pull that up for us? Thank you. We'll give you all just a moment to fill out the poll. I think we can probably pull that down now. Awesome. Great. We always have a strong showing from the nonprofit community, both at the community and national level. It's nice to see everyone here and to see a good showing by our academic partners and some state government. So thanks so much. I'm really excited about today's session. We're going to be talking about food security data, which is something that I think is on a lot of people's minds these days. Let me first of all tell you a little bit about the organization from which our speakers are represented. We have Children's HealthWatch, which is a nonpartisan network of pediatricians, public health researchers, and policy experts committed to improving the health of young children in the United States by focusing on the real experiences of families facing economic hardship. Founded in 1998 by Dr. Deborah Frank, Children's HealthWatch collects real-time data about infants and toddlers under the age of 4 in urban hospitals in Boston, Little Rock, Minneapolis, and Philadelphia. The organization's core mission is to highlight the impact that economic and social factors such as food security and access to affordable housing have on the cognitive and physical development of very young children, especially during their most formative years. What sets Children's Watch apart is its unique frontline approach. Over the years, the organization has built the largest and most comprehensive data set of its kind, with nearly 90,000 surveys that capture not just physical health, but a full range of factors shaping children's well-being. The primary goal of Children's HealthWatch is to provide policymakers, academics, and the public with timely, accurate information about the health and well-being of low-income children. Their ongoing research acts as a barometer for how public policies are affecting the nation's youngest and most vulnerable citizens. By translating this cutting-edge research into actionable insights, Children's HealthWatch equips decision makers at all levels to develop policies that promote equal opportunities for all children to thrive. Today, I am pleased to have with me Ana Poblacion, research scientist and director of Multisite operations, and Charlotte Bruce, who's coming to us live from the State House in Massachusetts, director of policy. So welcome, Ana and Charlotte. I'm so glad to have you both here for this important conversation.
Thank you so much for having us.
All right. So Ana, I'm going to start with you. Children's HealthWatch collects real-time data from caregivers and emergency departments and clinics. What unique advantages and limitations come with gathering food security data in these fast-paced medical settings?
That's a great question. The first advantage that comes to my mind is the pool of people we interview, our sentinel sample. So patients come for care at one of our hospital locations, and we utilize this pool of patients to offer participation in our research. So that's one. Another advantage that comes to my mind is rate of participation. So patients already have a bond with their primary care provider, with the hospital. They have trust in the system, so they often accept to participate in our interview. Another advantage is the food security tool we use to collect data. In our survey, we use the 18-item household food security survey module, the gold standard measure of food insecurity in the United States, which determines the level of food insecurity among adults and children in the household. And all these three are great advantages, but they are like Children's Health Watch. It's how Children's Health Watch collects data in medical centers, but there are other ways to use data already collected by healthcare settings, such as tapping into the electronic health record food insecurity data. Many healthcare systems already have embedded food insecurity screens into their routine of care, so investigating this data can help folks understand their population and monitor levels of food insecurity risk. And now switching to limitations, what comes to my mind are the usual limitations of all data collections, which are like from security and privacy to data quality and accuracy to cost to ethical complexities. But in my view, they are all manageable. But one thing that directly relates to data collection in medical centers is the nature of the setting itself. So patients may be called into their visit or have their visit end earlier than expected. So the consequence of that is that our encounter with the family might be finalized before the end of the survey. But I don't want to end this in a negative note. So we have been doing this for more than 27 years. Data from our 90,000 records have been helping change policies in the local, state, and national level. So we are thankful for the entire team and also the families who agreed to provide our stories. And this is a success story.
Fantastic. Ana, I probably should have started by asking you if you would just set the stage for folks. Data is limited right now. And so I wonder if you could just say anything about, why this is so important right now, what you're doing. Not only has it been important, but even more so in the current, in our current context.
I'm so glad you asked that. So I think to answer this, maybe we should go back in time a little to give context to this response. So historically, household and adult and child food insecurity has been collected using the 18-item household food security survey module. More specifically, we at Children's Health Watch, we are interested in seeing the child level food insecurity. So we use the 18-item because it contains the household, the adult, and the child level food insecurity survey. But sometimes asking 18 questions isn't a possibility for researchers or clinical studies. So we at Children's Health Watch developed the abbreviated Child and Adult Food Security Survey, what we call the ACAFS, an 8-item survey able to identify levels of food insecurity and severity among adults and children in the household. And this survey tool has been utilized by health systems and researchers throughout the country in order to continue to monitor the experience of food insecurity among adults and children in the household. In fact, the Well-Being and Basic Needs Survey will be using the ACAFs to collect nationally representative data on food insecurity using the ACAFs in 2026. Now more than ever, the food insecurity data collection has been paused by the federal government. We academics need to continue to monitor not only the experience of food insecurity among adults, but more importantly, the experience of children. So I really want you guys that are listening to us today to think about, using an appropriate data collection tool food insecurity tool, they might not show the consequences of food insecurity in the bodies and brains right away in children, but we know that the lack of food in this critical period of development imprints damages that perpetuates for life. So, yeah.
Perfect. Thank you for that. Um, could you also say a little bit while I have you about your approach and how you ensure the voices of families most affected by food insecurity are authentically captured rather than filtered through institutional and clinical perspectives?
That's another great question. Thank you for that. So although we collect data in these medical settings, we have autonomy when it comes to data analysis and dissemination. We have our own team of researchers, data experts, statisticians, and policy experts that translate data into actionable items. So also families trust and play an important role in this data, obviously. So families feel comfortable sharing sensitive information with us. Some of our families have provided information more than once over time, what we call repeaters. In this same vein, we have, trained research assistants talking with families, so real people talking with real people. And although the objective of the Children's Health Watch data collection is not qualitative, our RAs are trained to listen to people. So attentions is one of our key success factors. And finally, I believe that we placed the food security questions in the survey after families and RAs have bonded over, other questions. And the fact that we use the A-team item household food security survey module, which builds from less to more severe categories, also contributes to the trust building. So all that leads me to say that our data is trustworthy and our job is to tell the stories of our families, no filter.
Fantastic. Charlotte, I want to transition to you and move into some of the policy questions and implications. Can you share any examples of how findings from your food security data has challenged policy assumptions or influenced decision makers at different levels, local, state, or national?
Absolutely. And thank you so much for having me, everybody. And apologies for me being on the phone in this image. I was having some connection issues with my headphones. So I am indeed on the phone with all of you, but of you on here. Yeah, Ana described really well our data collection, which she leads. And so my role as policy director is really to take all of that data and package it for policy audiences. That's the origins of Children's Health Watch in many ways, as a group of pediatricians after welfare reform got together because they were really worried about the impact cuts to the safety net program, like food assistance programs, like cash that help family afford food, was going to have on their patients, on their health and development. And so they hypothesized that if they track changes in hardship, like food insecurity and health outcomes, they could influence policy decisions. And so we've been doing exactly that for over 27 years at this point. And so our work is really about mapping trends in food insecurity and in hardship on policy moments and decisions. And so I would say something that surprises folks, I'd say overall in national data is really when we look at the rates of food insecurity among households with children, and sort of the disproportionate prevalence of food insecurity, I think already provides us with an opportunity to really center kids in the policy conversations. But in my own experience leading our state and federal advocacy, I found that what's most impactful in influencing policy decisions is really the relationship between food insecurity and, again, policy decisions and program participation. So really demonstrating how, in many ways, food insecurity is a policy choice and that we do have solutions to address it, evidence-based solutions to address it. So, for example, we do a lot of work around, yes, tracking food insecurity, but also looking at programs like SNAP. And so we have a lot of research around the ways in which SNAP can help reduce food insecurity, looking at families who are income eligible but not participating versus those who are participating. And so being able to take those trends to policymakers and demonstrating that even a temporary loss of SNAP can really have a profound impact on children's health and development. And one very recent way that that data was used in the policy world was, I'm sure many of you are familiar with, the shutdown and the SNAP pause and threats and all the whirlwind of things going on at the federal level there. And so there were several different cases, and apologies again for background noise, but there were different court cases going on, and they actually cited Children's HealthWatch research that is harmful for children for food insecurity. And so that's one example of the ways in which data can really be used to inform policy and to at the end of the day, support kids. Local data. So
Oh, sure.
a lot of the ways that
Okay, that's okay.
Good.
Go
Was
ahead
I going
and finish.
in and out? Oh man, this has been my issue all day, is the sound. But
You're good
I just
right
want to
now.
highlight the local data too, really informing decision making, both policy wise, but also even just local intervention. So oftentimes certain communities can have trends in food insecurity or like populations that are being impacted that are different than national trends, and being able to have that data to inform local interventions, like, for example, in hospitals, if they are seeing a high rate of food insecurity among their patients, and then they decide to stand up a food pantry or a robust referral network to connect patients with SNAP, that data is really important in informing institutional policies as well.
Fantastic. I know I'm going to test our luck here with your connectivity, Charlotte, but I'm going to ask you another just question if you can.
Yeah, please.
How do you address skepticism about self-reported food security data? Do you have any do you get any skepticism, from policymakers or the public? And I'm also wondering, do you find that policymakers and even the public have a certain image of maybe who's food insecure, and does your data help change any of those perceptions?
Yeah, it's a great question. And I'll start with the second part first. Is I think certainly you can see that skepticism of, like, somebody has in their mind an image of what somebody who is food insecure looks like, or you hear it a lot with, an image of what someone who's experiencing homelessness looks like. And so challenging that to show that oftentimes these hardships are invisible in many ways, especially with kids and with families. And so that's certainly something that we challenge in that data, as well as like narrative and storytelling. So I would say too, some of the most important or impactful policy conversations I have are when we pair the two together, of showing this is like the data that we're seeing in your district, the data we're seeing nationally, but also having someone there to really speak to it, to put a face to the name and to the data. Because, in data sets, we're looking at thousands of people, and it can be, really easy to not think of the individual or the person in your community that is represented in that data. So it's definitely pairing those two together is important. I would say two things on sort of the skepticism. One, I would challenge that there is skepticism in some ways. I think Ana spoke a little bit about the pause in data collection at the federal level. I would say to be a little cheeky in many ways, but I would suggest that that sort of proves that there is a lot of validity and like lack of skepticism in food insecurity data. I think that there's a fear around, tracking food insecurity from the policymakers who just made massive cuts in safety net programs like SNAP that, we're going to see, or we would have seen, I think many of us believe, big spikes as a result. So I would say, that even proves in many ways how important the food insecurity tracking is and the validity there. The second thing I would say, if I were to receive that sort of skepticism from somebody, would just be that food insecurity or food security is an experience, and it can't be measured with a clinical text. And, we treat many clinical conditions that are self-reported, like pain or like depression, anxiety, and, food insecurity shouldn't be any different. And then I would also say we do see some symptoms of it, so if it's self-reported, we're also then likely to see poor health or development, or especially on young kids, which Children's Health Watch focuses on. So we can pretty quickly see the actual impact of the food insecurity, but I think there's a great importance in believing people and self-report. And I would say some of that bias is actually coming from sort of the skeptics themselves, and would push back on that narrative for sure.
Thank you. Really great answers. I'm going to put you on hold for just a second, Charlotte, and want to remind folks that please put in some questions that you have for Ana and Charlotte. We are getting a few coming in, but keep them coming. We'll open that up in a minute. Ana, are there innovative data collection methods or partnerships that you're exploring or you wish you could explore to fill blind spots in understanding of food insecurity with children?
That's a great question, and it's a very good opportunity because we are about to launch, Children's Health Watch is about to launch what we are calling Democratizing Our Data, which is a very intuitive name. This new initiative will build on the existing and ongoing data collection and make our data, Children's Health Watch data, accessible and available to a wider audience via a data dashboard. These user-friendly interactive interface will be available on our website, which anyone will be able to produce customizable, actionable analysis that you guys can take to city halls, state houses, or even the halls of Congress to push for policies in many distinct domains, food insecurity obviously being one of them. We will launch this initiative in early December in our website, so childrenshealthwatch.org, all together in lowercase, so stay tuned.
Oh, that's fantastic. That was one of our questions is this information publicly available? Can you say a little bit, I'm going to skip to one of the questions that was asked by the audience. How is your data applicable to discussing national trends? You're in four cities, four hospital systems. So can you say anything about how applicable it is across to look at national trends, or can you look at national trends from this data?
That's an awesome question. Our data set is not nationally representative, but we are in different states throughout the United States. So we can kind of say something about what's going on the north or on the south, on the northeast. So that is our kind of national presence, if I may say. And I think our data, because it's not nationally representative, is a Sentinel data. And because we have been collecting data for 27 plus years, we do have our own trend of food insecurity in the household and in the child level that mimics the trend of the USDA, right? So our trend, or our curve of food insecurity prevalence mimics the same trend as the USDA. Okay. Knowing that the two samples are different. So I think the important piece that I want to maybe highlight here or underscore here is it doesn't matter if you have a nationally representative data set or not at this point. What we need is the continuous data collection so you can see if your trend in your micro or your megalomaniac, data set will change according to policy interventions. So that's what we want you guys to pay attention is going to spike, is going to decrease, is it attached to a policy that was implemented? Can I push for policies in my local, state, or national level with my data set? So maybe you cannot speak to a national policy, but maybe you can speak to a local policy that was implemented in your city, in your county, in your state. So I think that's how I see that. The importance of data collection is across the board. especially at this time.
Great. Are you all thinking, I'm not saying it's easy at all, but are you thinking of expanding to any cities? I'm sure it's been a lift to do it in 4.
Yes, as a matter of fact, we have been trying to expand. Yeah, we have had in the past other cities. We had Maryland, stopping collecting data for 20 years and stopping in 2021. So we have like in and out cities that have contributed to the Children's Health Watch data collection. We are thinking about, because we collect data, I think our biggest thing is that we have a person-to-person connection, right? So we either have data collection in our emergency rooms or in our clinical settings, or we telephone them. People come to the settings and then we call them later. So, but all that to say that the special sauce of Children's Health Watch is the humane connection, or the human connection. So expanding is kind of like tougher for us, but we're open. If anyone wants to host a Children's Health Watch site, please contact me. We can talk.
Great, great. Charlotte, I'm going to try for one more question for you. And that is, what's a story from the data that you think deserves much more public attention? Something that isn't being discussed enough in today's policy debates?
Yeah, it's a good question. I mean, I think there's so much under the surface of our data, especially like the personal stories that we get at. So our data is primarily quantitative, that we capture in our surveys with families, but our research assistants, like Ana was just mentioning, we really value that one-on-one connection. So they get so much more stories from families that just always come through in a lot of data sets. So I think that's often missing, which is again why I encourage like effective policy messaging to really pair the two together. One thing recently missing or that I've been thinking a little bit about is I've been encouraged to see a lot of public press attention on things like SNAP and the SNAP pods. I think, maybe others on this area and people from other walks of life who typically talk about food security and about bringing it up.
We're losing you, Charlotte.
And attention. Oh no, is this better? Okay.
Now that's better.
Good. Well, I was just saying I've been encouraged to see some of the focus in media lately on SNAP cuts and on sort of the impact. And now that the shutdown is over, really threading the needle about future threats and recent cuts, and saying that this was in many ways a preview of what's to come. And so I think continuing that narrative, and then also again mapping on top of that, like these threats to data that, we have these stories that's demonstrating, and we have these local data sets, but this is really like a time for data collection to step up. And so I think a lot of people in this world are aware of what is happening at the USDA with data collection, but it's not necessarily a message that's breaking through more broadly. And so I think that's one piece I'd love to see come out more, is that, we anticipate a certain effect, and we also anticipate that it might be invisible in many ways. So now is really an important time for local data, state data, really just as much as we can collect that information to inform policies, and in many ways policy mitigation attempts at the local level as well.
Thank you. Thank you for that. Yes, very important that we're all thinking about how data can continue to be collected at various levels right now, when there are pauses at the national level. I can't believe we're down to a minute. This time always goes so fast because the conversations are so interesting. I wanted to ask the audience, we always like to ask people if there's one thing that they're going to do this week because of what they learned today. And so we welcome you to put that in the chat, which is open now. So if there's any one thing that you are going to do this week because of what you learned today, we really would love to hear that. And we really appreciated all the great questions that everyone answered. I know that Diane and Sharon were behind the scenes answering some as well. So again, I really want to thank you, Ana and Charlotte, so much for being with us today. Charlotte, especially for finding a seat in the hallways at the Capitol and making this happen. We really appreciate you being at the Capitol and then making the time to do this. So again, thank you so much to both of you for being here. I want to also remind folks to join us on Wednesday, December 17th at the same time for our last webinar of 2025, which I can't believe. We've had a great year of webinars, so hope you'll come back for that one. And to remind folks that before you totally sign off, there will be a survey that comes up. Actually, I think it comes up when you leave the meeting, but if you can make a second to fill it out, we sure would appreciate it. We give that data to our presenters, and it's really helpful for us as we seek to continuously improve. So again, Ana, Charlotte, thank you so much. And wishing everyone a great rest of the day and a very happy, grateful Thanksgiving holiday that is in front of us. So thank you so much to everyone. Have a great day.
Thank you.
Thank you.
Thank you.